Today is April 9th. It is 2:15 in the afternoon. I'm headed, and it's a Thursday, so y'all know I'm headed to my pharmacology class. I think I'm just tired of driving. I think that's it. That's it. But y'all haven't seen me in what, 3 weeks, a month. So just to give y'all a quick little update, since we haven't seen each other in a few minutes. So not last week because that was spring break. I went to Miami. It was fun. I went with my husband. We had fun. It was fun. But the week before that, I had my second foundations exam. I also had my first dosage exam. I think that was the same. Yeah, it was the same week. So for dosage, for dosage you have to score 90. I got 85, so I have to retake that next week, Monday. And it was just little small stuff. Like, I'm like, I should be able to get that 90 or 95 or 100 next week. My fundamentals or foundations, for that exam, for the second funds exam, I got a 84 point something. It was like 84.83 or something like that. I don't remember. But I passed that one. This week, Tuesday, I had funds, I had foundations, funds, fundamentals, whatever you want to call it. Yesterday was Wednesday. I had lab, but that was our physical assessment skills test. So we had that, right? I didn't pass it. I failed my physical assessments skills test yesterday. Bruh, I was so upset yesterday because, hold on, I didn't eat all day, so I'm drinking in the shore. I didn't eat anything today, and it's kind of warm today. I just feel some type of way. Hold on. I might talk to y'all later. I don't remember where I left off earlier, but I'm gonna just start over from when I took my physical assessment skills test yesterday, that I failed. And now it's my turn. I'm going through it. I'm doing everything I need to do. And then here come, I do the lung sounds, and then now I'm about to do the heart sounds. I'm doing the heart sounds, y'all. I'm like, okay, listening to the aortic valve in the second intercostal space. Something like, whatever I said, it's something like that. And then I went on the left side, and I was listening to the tricuspid valve in the second intercostal space. But I went back. I was now listening to I was listening to the I know I pronounced that word wrong, but listening to the pulmonic valve in the second intercostal space. And then I went down to listening to the tricuspid valve in the fourth intercostal space, listening to the mitral valve in the fifth intercostal space. After that, that was pretty much it. I ended it. I, documented, closed it out, ended it or whatever. She got up and she went and asked my professor a question, because she was saying something about the heart sounds, she wanted to be sure about something. I don't know. I was like, oh my god, I know I messed up, but I feel like she could have just gave me some points off. But anyways, she went and talked to the professor, and I was talking to the girl that I, my partner or whatever. I'm like, oh my gosh, I'm just what? So I was just talking to her for a second, and like panicking because I'm like, why is she getting up and going to ask her a question? Like, when she come back, what is she going to say? Like, so when she came back, she told me to come over here for a second. I was like, yeah, I just know I failed. I'm just like, why am I going over there? Like, why you want me to go over there? I was just so, I'm just like, oh my God, I just know I failed at that point. Because I was like, what the heck? Like, so we got over there. She's talking to me about, mind you, she's really cool, really nice, you know, just chill. She said I need to work on the heart sounds. I'm not trying to, you know, like, she's the actual nurse, like, you know, she got her degree. So I'm not trying to go against, you know, her too hard, but I'm like, the tricuspid valve, that's on the left side. The aortic valve is on the right side. Like, I know that for a fact. I'm like, I know, and I'm doing it this way because this is the way that I was tested. Like, this is literally the way that you're going to test. You're going to listen to heart sounds. If your patient is in front of you, this is my right side. This is their right side. Like, you know what I'm saying? This is their left side. You know, so it's like, I'm like, and I'm also thinking, I'm like, maybe she's thinking like I did it wrong, but I'm like, aortic valve, for example. So I said, aortic valve, in the second intercostal space on the right. That's what I said. But apparently they want you to say the aortic valve at the second intercostal space at the right sternal border. Are you serious? So that was another thing. So I'm like, but she said I did perfect on everything else. It was literally just the heart sounds. So I'm just standing there. I'm just like, my eyes getting teary because I'm getting emotional because I don't know, like, I just been extremely emotional these past couple of days. But like, emotional, like the emotional, I've never been this emotional before. And I was getting teary-eyed. I'm trying not to like cry, but I wasn't like crying because I was sad. I was kind of just like frustrated and disappointed because I'm like, I did not come in here, I did not expect to come in here to fail my physical assessment today. Like, I really just did not expect to fail it. Granted, I know the heart sounds was somewhere I struggled with, but I really thought I had it down. And then it was like little stuff that I just felt like I could have just got like points or something taken off on, not a whole like fail. Like, I just felt, I don't know, I was really disappointed. I went to the car. I was getting teary-eyed in there, so I had to leave. I'm like, I'm about to go sit in my car, but I did want to talk to my professor before I left about it because I felt like, you know, I just had to feel like some confirmation. Like, you know, can't we like do it over? Like, can't we get enough, like, say, like, we didn't end the physical assessment yet, and I still had a lot more time. Like, they gave us 20 minutes. I'm like, I know I have time to correct myself, like, you know, go back on stuff or, you know, make sure I'm double checking everything. You know what I'm saying? So I just felt like that shouldn't have failed me. And I feel like that was why I was so like upset because I'm like, are you serious? Like, I feel like she literally said I did everything perfect but those couple things. And I'm just like, then she also mentioned the fact that I mispronounced pulmonic. I'm just like, yeah, okay. I went and sat in my car for a second, and then I was looking for my professor, but I couldn't find her. I was assuming that she was testing people, which I'm pretty sure she was. So I'm just like, I'm just go home. But I was really upset yesterday, like, so upset. And today I'm not upset like how I was yesterday, but I do still feel like, are you serious? So basically I have to wait until my professor says, like, you know, when we have to come back to do our physical assessment again, which will probably be on, I honestly don't know when she would, probably next week. Yeah, it might be next week. Yeah, honestly, it might be next Wednesday maybe. I'm hanging in there. I'm still doing good. I just feel disappointed in myself because I'm like, I've been doing good on everything, but how did I go in there and just freaking fail my physical assessment skill test? Like, ugh, I honestly just disagree. Like, I really personally, I just disagree. The only thing that's really killing me about it is that it's the fact that I failed it, one, but if you pass on the first time, your skills test on the first time, you get a 100%. The second time and you pass, you get a 50%. So now, once I pass, when I retake it, I will get a 50% on it, not a 100. And that's what's killing me. And if, say, you know, you don't pass on the second time, you don't even get any, like, credit for it. You just still have to pass it because it's a requirement. Tell me how my back looks. Cause I know I need to lose weight, but it look bad. I know, y'all, I'm getting big. I'm gonna see y'all next week because that's when a lot more stuff is happening. Like, I have my dosage exam, then I have my second pharmacology exam. So I'm gonna see y'all next week. So I can tell y'all those results. This is killing me. Like, what is that? What do y'all want me to do with it? Alright, whatever. But alright, y'all. So yeah, I will see y'all next week. Stay tuned. Hopefully it's just good stuff next week. Please. Because I need it. I really do. But yeah. Bye, y'all. Hey guys, today is Monday. It's April, I think it's the 13th. I'm about to go to my school because I have to take my dosage exam, as you guys know. I got a 85 on my last one, so I have to retake it and get a 90 or higher in order to pass. So let us pray. So yeah, that's what I'm doing right now. It is 2:09. I will probably get to my school around 3:30 probably. This time I still feel confident, but I mean, I went over the problems that I had got wrong on my last exam. I just kept practicing those. I'm gonna practice some more when I get to my school or whatever. But so I will see you guys later. Probably maybe when I get to school, or probably after I take the exam, and I'll tell you guys my score and, you know, like, pass or fail. Hey, I'm at school. It's 4:30. I've been at school for probably like an hour. Just been out here studying. I think my only concern are now, not really. I was gonna say my concerns would be the pediatric questions regarding the weight, like that whole thing dividing by 2.2 and all of that. I got those confused last time, both. And then I forgot to round up, and that's why I got 3 wrong last time. So I know what I got wrong, I know what I did wrong. So I'm just hoping that, you know, I do better this time and that I pass this go around. And we don't need our laptops because I don't know if I told y'all or not, but the whole program where the whole software where we take our exams is down. So I think we're going to be just doing it on paper, which is fine with me because I don't mind it. What else? I think that's it. I'm also a little bit nervous about the converting part, like ml to cup. Like, how many? Like, you just gotta remember, like, the basic thing, like, it's 240 mLs in 1 cup, I think. But okay, I'm about to go over here and I will see you guys later. Yeah, wish me luck. It's 6:11. I just finished. Well, we didn't just finish, but we went over and stuff. I got an 85. I need a 90. I got an 85 again. Are you serious? Oh, I did not mean it. I did not mean to take this. I might have to bring it back another time. I am So, 85. I got an 85 last time. And like the questions that I got wrong last time, I got right this time. The stuff that I got wrong this time was stuff that I didn't get wrong last time. And it was the heparin question, which I was iffy about. I think I told y'all I was iffy about that one. It was one of the infusion pump questions. And it was, I can't remember what else I got wrong. I can't remember the third one I got wrong, but I got 3 wrong, y'all. So, good thing we get like, what, 5 tries total. I think this is our second attempt. So we have 3 more tries. And next week Thursday, we'll do our 3rd attempt at Dosage. I don't feel like super disappointed, but I do at the same time, because it's like, you got another 85, like, come on. And then it's stuff that you, like, you know what I'm saying? Like, you didn't get this wrong last time, so, like, why did you get it wrong this time? This Thursday, I will be taking my second pharmacology exam. So, I'm going home and study for that. And I will see y'all on Thursday, because, tomorrow I do have foundations. Wednesday I have lab. Thursday I have pharmacology. So I won't be recording Tuesday and Wednesday, because it's really nothing to record or talk about. I'll be recording Thursday, because that's when I take my exam, and I'll come back with my exam score like I always do. Hey guys, so today is Thursday, and today is exam day. So it's 2:13 right now. It's time to get to school around 3:30. So I have plenty of time to just chill until the exam starts. Y'all know I'll be nervous before the exams, but I be cool. Like, I don't be like too nervous, but I am nervous. But when I get to school, I'm gonna study some more. I brought my iPad. I also bought my laptop, because we have to take our exams on our laptops. I bought my purse and my makeup bag and a notebook and my headphones, because when I get to school, I'm gonna study a little bit. So I'm gonna just need these to just block out everything. I feel good about what I studied, but I feel like I want to study like a little bit more. I also want to take some more practice exams, so that's what I'm gonna do as well. Let's get this drive going. Hopefully traffic isn't too bad, but honestly, I've been doing this long enough, and I know traffic is gonna be terrible. So that's fun. But I will see you guys when I get to school. Okay, I'm at school. It's 3:52. I'm about to study, about to do some practice questions. I really hope I do good on this exam, because I don't know if I said this already, but I think this is like the make or break. Like, so for pharmacology, we have 3 exams total. The first one, the second one, which is the one that I'm doing now, and the third one is the final. So it's like, this is the second one is kind of the make or break, because if you, depending on how you do, is you're either going to be like chilling for your final, or you're going to be fighting for your life for your final. So I'm praying I don't have to fight for my life. I've been doing good so far on my exams, so I just want to keep that up. I also want to say, I don't think anybody should ever get too comfortable, because I've noticed that some people do get comfortable with their exams, you know, maybe their current grade and stuff like that, and something will humble you and sit you down. And like, you might do good for the first exam, the second exam, and then the third exam you don't really do too good, or the second exam you don't do too good, so now you really got to be fighting for your life. That's why it's good to do all your work, because that also boosts your grade as well. but them exams really are a lot of your grade. So but like I was saying, don't ever really get too comfortable. Always continue to be humble, and it's good to be confident, but don't overdo it. Like, you don't have to be conceited. Like, it's the difference. Definitely just chill out, do what you got to do, and stay on that level. You don't have to feel like you're doing better than other people, and compare yourself to other people, even if you're not doing as good, because you never know. Like, you can always, just like how somebody can be doing good and then don't start spiraling down, you can do the opposite. Like, you're not doing good at first, and then you start doing way better. Like, you know what I'm saying? So it can really just go either way. So that's why I always just stay confident, but always just at that humble level, because you'll never know. Like, you'll never know. Like, something really can just come out of nowhere and humble you. I don't know why I always decide to rant, but that's me. Okay. Yeah, I will see you guys after my exam, of course. Just wish me luck, and yeah, I will see you guys later. I'm gonna come back, tell y'all how I did, how I think I did, the type of questions that I felt like, you know what I'm saying? Like how I always do that little debrief after the exam. And then tonight, because she gonna post them exam grades tonight, I'll tell y'all my grade, and I hope it's good. But all right, y'all, bye. I will see you guys later. I don't know why I have so much energy. I just feel really like positive right now, just trying to keep that good spirit going. So yeah, I will see you guys later. Bye. That was terrible. Like, yeah, I don't have too much to say about that one, but I didn't like that. I don't feel good at all, and I'm nervous. Of course, I'm nervous. And my anxiety is about to be OD until I get my result. When I was telling y'all this is like a make or break, this might have broke me. I might be fighting for my life for that that final. I'm still rooting for an 80, but that didn't feel like 80. That didn't feel like an 80. The bare minimum 75 I'm rooting for, but it could be that or lower. Like, I am unsure. Like, that really just wasn't fun. If I passed, it was barely. If I didn't pass, I'm not putting it past me. Like, I don't know. I don't have too much more to say, y'all. I just have to wait for those results. Like, that really got me. I don't. So I guess I'll just talk to y'all later. And I'm so scared. I'll talk to y'all later. Okay, y'all. It's 10:17, and she just posted grades. I'm scared. My curls fell. I was stressed out for since I left school. Like, I just been sitting here waiting. I don't think I did too good on this one. I don't think I did good at all, actually. So the bare minimum score that I could receive, that I would be like, okay, is a 75%. Because that's literally the bare minimum that you can score to pass the exam. I'm shooting for a B. I'm shooting for like an 80% or higher. That's what I personally want. If it's something lower than an 80, I will be okay with a 75. But I really just don't know. I just don't feel good. I'm so scared, but I'm gonna have to look at it. Um, yeah, I'm really scared right now. I'm so scared. I can't look. I can't look at it. I just can't look at it right now. I can't look at it right now. I'm scared. I'ma just have to look at it. Oh, my stomach. Okay, it's a 78.69. Okay, a 78.69. Okay, um, it's not terrible. It's still passing that 75%, which I'm very happy about. But I just knew that one took me through there. Like I just knew that one wasn't great. But a 78.69 is still passing, so I'm grateful for that. So yeah, I don't have too much to say, but that was tough. A 78.69 sound about right for that one. Yeah, I don't have too much to say, so I'm gonna end this video here. I'm just glad that I passed. Like I'm glad I passed that exam. It's not the exact grade that I wanted. Like I said, I wanted the 80 or higher. I got a 78.69, but you know, I have to just do really well on my exam 3 on my final. So yeah, thank you guys for watching, and I will see you guys in the next video. And I hope you guys enjoyed this one. And thanks for watching. Bye.